All right, well, hello everyone and welcome. I'm Krista Oliveira. I am the Chief Development Officer at LSU Health Foundation. And thank you for joining us for our second webinar on the coronavirus. We are doing an entire web series in inviting experts at LSU Health to come and talk to us about the coronavirus and what LSU Health is doing to be on the front lines. And I'm joining from my home, as we all are, and how exciting it's been for all of us to get used to that. And as Sam mentioned earlier, everybody's mics and videos have been turned off because we have had instances of our colleagues having hackers join these types of meetings and wreak a little bit of havoc. So to hopefully combat that, we have muted and turned everyone's videos off, but please post your questions in the chat and we will save time to answer questions at the end. Today, we're going to be hearing from the team at our LSU Health Sciences Center Family and Child Counseling Clinic. And to kick us off, we're going to hear from Dr. Dugan, and she will give us an overview of how the clinic is supporting our community. Dr. Dugan, welcome. We're grateful to have you.
Thank you. And thank you for having us today and our team. Our clinic, the Child and Family Counseling Clinic, is housed in the School of Allied Health Professions in the counseling department, whereby we train and provide education and clinical services to our master's level students, as well as the children and families in the greater New Orleans community. We have been inundated with a positive response from our clients in their pursuit for continuation of services. And LSU has wonderfully supported us through this new venture and giving us the right technology and systems and practices as far as ethical and legal considerations are purported. We serve not only children, but families in the greater New Orleans community, and we have 4 faculty clinicians who are providing current services today, 3 of which are licensed professional counselor supervisors, and then we also have a licensed school psychologist who's continuing to provide educational and psychological assessments. Prior to Hurricane Katrina, myself, I had pursued an employment opportunity at LSU and was quickly welcomed in bringing over a clinic after Katrina had hit. And from that first clinic operating room in 2006 to where we are today, we continue to provide an abundance of services to our clientele. We also not only provide services for the community and the families that we provide services to, but we also train not only our master's level students that are currently in our own counseling program, but we also provide training opportunities for other students in the greater New Orleans area, including universities that are housed in Hammond, for instance. We provide the individual, group, and family services. We are also utilizing those services via the telehealth platform, Zoom, in which we're on here today, and it's worked pretty seamless for us. Our clients are satisfied, we are satisfied, and it's a great way to stay connected with the families. One of our most important features of our clinic historically, prior to the COVID-19 pandemic, was to connect not only with the children that we provide services to, but the parents. And we've been able to continue that partnership. We believe that it is a priority to stay connected with the parents during this time, especially more so than previously in our clinic. It is our mission that we connect with the parents in order to help facilitate their understanding of the work that we're doing with their children, and also to provide them support and resources through this stressful time.
Okay. Thank you for that, Dr. Dugan. And so I think one of your colleagues is going to be speaking next.
Yes.
So we just recognized, as Dr. Dugan was saying, that parents are such a crucial part of all of this, and really getting the message out that parenting is just different right now. Parents, it's not the time to try to be perfect, but recognizing that we have to take care of ourselves as parents first. There's a lot of stress out there, whether we've got parents who are truly unemployed at this point, underemployed, or trying to work full-time from home while raising young children. This is causing lots of different challenges, and every parent knows their child best. We have all believed that from the very beginning, but this is really holding true during this time as well. You know what you and your family need. I think that we saw the first week people just kind of stunned by all of this. And then as we've moved through it, I think that families have kind of worked to try to find what people are terming their new normal. And they've had challenges along the way, but there is no one size fits all to working through this. And so I think that that's an important message for families to hear right now, is that the way that your family is working and providing possibly homeschooling to your children is going to look different than other families that you're connected with. And that's okay for parents to really kind of put that out there, that their way of doing it is absolutely fine. We recognize that I think the press continues to use the term homeschooling. Homeschooling parents are parents who made the decision to homeschool their children and usually put a lot of work into selecting a curriculum and outlining how they were going to do that with children. We are not homeschooling our children. We have children who are going to school at home due to a stay-at-home order. And I think that as soon as we recognize that, I personally went to school for a very long time. I did not go to school to be a teacher. I am not going to pretend that I am a homeschooling parent. And so I think that it's important that we really get the message out there that this is different. This is not something that we elected to do. And so, you know, you're working with your child's school, but you may have to have some flexibility. We have some children who are having to share computers. We have some children who are using old-fashioned pen and paper to do packets sent home from their schools. But you're going to have to work to decide how that works best with your family. Sometimes there's just sheer bandwidth issues. And so the time that you thought your child should be doing math, they can't really do it because there's not enough bandwidth in your house. And so there's going to have to be some flexibility within your family system for that. We want to tell parents that it's really important that you remember your child had recess throughout the day. Your child had natural breaks in their day. And so the expectation that they're going to sit down at a table or a desk and do schoolwork for an extended period of time may not be realistic. And so finding what works best for your family in that way. And thinking about how you're using screens. I think our old ideas of media diets looks a lot different right now. We are not in a place where we're going to say you're only going to use a screen for 2 hours a day, because guess what? We're going to school and we're working via these screens now. And there's also some really amazing things that companies and zoos and aquariums and museums and things that we may not have had access to previously. So there's some good stuff out there, but parents still need to monitor that. But our traditional ways of viewing screens and screen time just may be different right now. And kind of our take-home message is that you know your child best and you know what your child needs. And there is no fits-all to how we get through this, but recognizing this is not our traditional way of doing things and our traditional ways of parenting.
Okay, thank you. Sorry, it's Dr. Camelford?
Yeah.
Okay.
And so too, one of the things our clinic did to create a resource for when we were transitioning from just providing live in our clinic care to our clients to then the telehealth platform is we created a little coloring book for our clients. And I did just post the link in the chat. So if people want to just copy and paste that, that way you have that resource right there for you. So the coloring book is called Caroline Conquers Her Corona Fears. And it's a nice tool for parents who may feel a little stumped on how do I talk to my kid about what's going on in the world. And it also gives the kids an activity of coloring to do, which we know has a lot of therapeutic value to color. Sometimes when we are very worried and our thoughts are racing through our head, to just kind of do something as simple as coloring, it's a mindful task, but it's also a mindless task. And so it helps us to give ourselves a little brain vacation, a brain break, if you will. And so when we put this resource together, we just decided, let's make it a coloring book so that it kind of emphasizes some of the techniques that we utilize with our clients in the clinic. And for parents who may be struggling with, what do we tell our kids during this time? We want them to be informed, but we don't want them to be scared. Some of the messages that we're trying to convey through the book is that kids need to know some information, and we also need to validate our kids and what they're feeling. It's okay for them to be worried. It's okay for them to be scared. We don't want to take that away from them, because we too are scared, worried, concerned as to what's going to happen. And so when we as parents, or when somebody tells us, oh, well, don't worry. Okay, well, easier said than done. I'm already worried. So by providing them some information and providing parents with this coloring book, it hopefully gives them a tool to use to have a conversation with their kids about some of these key terms that we've heard of: social distancing and flatten the curve. So how could we potentially use this book to ask questions to our kids? I always find, especially for our grade level children, it's better to ask them questions to see what they know before we just spill the beans of information overload. So sometimes we want to just ask those questions to hear what they know, and then tweak what it is that they're stating so that it is appropriate knowledge. And if we feel like that's sufficient, then we don't have to overshare more information that might actually heighten or escalate them. The workbook also, the coloring book, has some coping tips at the end, things like blowing bubbles, or kind of some what we would call a progressive muscle technique, where you tense your body up and then you kind of relax it and let it go. So these are some of the techniques that we would work with patients in our clinic, but parents can work with their kids on these, and kids can do them themselves. And so we thought, through creating this resource, it would just be a nice reminder to kids and their families of some different coping techniques that they could utilize during these really stressful times.
And I've seen a lot of people talking about and reading the coloring book online. It's like all over YouTube. People, when I Googled it, it was like, Miss Rosa reads the Caroline Cocker's or Corona Fears, and it's just like people reading it to, I guess, maybe their teachers.
We'll actually give ourselves a little pat on the back. Apparently tomorrow, the First Lady of our state, Governor Edwards' wife, Donna Edwards, is supposedly going to be reading it tomorrow at 11. So this little coloring book that we created as a resource for our clients has really grown leaps and bounds. We've had requests for it to be translated to Spanish for folks down in Puerto Rico, and just for other Spanish-speaking individuals. We've had requests, for it to be used in hospital systems in Chicago and school systems in Oregon. So it's really been a very touching experience that some little small project we made that was going to be for just our clients has really expanded and helped so many people.
Wonderful. And that link is on the chat now. That's the link you shared, Dr.
Yes, the link that I shared to everyone is the direct link to the coloring book.
Okay, wonderful.
To be found on our clinic website.
Okay.
Okay, great.
And so people can go on and they can print it out from there? Okay.
Yeah, you can print it out. It's a free resource, and that was something that we felt we wanted to do. Is people need resources, and the cheaper the better, right? So we felt by giving our community this as a resource that we want people to use it.
Yeah.
Right.
Oh, well, this was wonderful information. I have just a thought. I have a child who's extremely social, and so this situation has been difficult for her, you know, her normal routine is soccer, and she's on a soccer team. So she's interacting with all of her teammates at least once a week, if not twice a week. And then she's interacting at, you know, various theater. And so she's got a whole little group that she does theater with. And then she's got usually play dates or a sleepover on the weekend. And so this in shelter in place, no socializing on that level has been the hardest thing, I think, for my family to be navigating. Do you have any thoughts on how I could better be nurturing that side of her life during this time?
I think one of the most important pieces, as both Dr. Vaughn and Camelford spoke about earlier, was to return that responsibility back to the child, letting them come up with creative ideas. Children hold a lot of power in their thinking, and the more that we can return responsibility back to them to take, you know, sort of flight into that fantasy and imagination, the more that they not only feel better and those powers of play take over, but they engage in really important skills such as decision making, choice making, et cetera, that are going to be long lasting foundational building blocks. They'll surprise you each and every time when you ask them, you know, what ideas might you have about what you can do? And it might be something you've never even thought of, or it could connect with something that you were actually thinking about, you know, in that moment. But they'll come up with all sorts of things. I've had, you know, lots of people talking about, you know, I have a sixth grader of my own, and they're going to do a slumber party on Saturday, you know, from 5 to 10 o'clock. And everybody's gonna make popcorn in their kitchens, and everybody's going to, you know, share snacks virtually, you know, and watch the same movie, et cetera. They're coming up with these ideas on their own. And it's our firm belief that children have the capacity to take themselves toward positive inherent direction, that they're able to, you know, capitalize when they're feeling bored, when they're having nothing to do, et cetera, to take that flight into fantasy. And it's the most reliable internal source, you know, that can help them stay happy and successful.
That's wonderful advice. Thank you. That is wonderful.
We do have a couple other questions that came in. Oh, someone is asking if you can, is there anywhere that they can access stress releasing procedures, like the blowing the bubbles and the things that you talked about that are in the book? Is there another place where they can access those, like a list of those kind of activities?
We, on our social media page, have been having a daily stress activity that Caroline is going out and doing. So I would recommend that everybody who's interested, you could like us on Instagram and Facebook, and then you would get those tips that way. Otherwise, some of those activities are in one page towards the back of that coloring book. It gives a list of blowing bubbles, doing yoga, pretending you're a turtle to sneak into your shell. So we have some of those listed at the back of the coloring book.
All right, good. And then I didn't know y'all were doing that on social media. So I'll actually share that with our audience too. That's cool. Okay, how much detail should you go into about COVID-19 to a 5-year-old?
I think that's a hard one. I think that we, unfortunately, have had some schools who have made the decision to use some words that I think I personally would not have chosen to use with children of that age. And so I think, much like Dr. Camelford said, you really do need to first inquire about what your child knows and meet them at that place. But I do think that we really do need to kind of keep it short and brief with 5-year-olds. We have to think about their developmental level and their understanding. I would not want a child to believe that school is an unsafe place when we are returning back out into the world, or that there are germs in the school that are going to hurt them. And so I do think that we have to not only think about the messages that we're sending here today, but what those messages will mean as we return to schools and grocery stores and restaurants and all the places that we're all looking forward to returning to. We have to think about how those messages will meet them there as well.
Right, that's a good point.
I think also just using some other bibliotherapy. They have like the very classic book of The Very Hungry Caterpillar. And so it talks about how you're going into a cocoon. Well, right now we're all in our cocoons. So we don't even necessarily have to expand to say why we're in our cocoons, because sometimes kids' brains just don't go there. They just know we're in the cocoon. And so then to kind of use that visual of then everybody's going to be these beautiful butterflies, is something that could be a fun way to kind of compare some books. I know too, a lot of people are going on bear hunts right now in their neighborhood. So talking about how, we're just hibernating like bears right now, because bears need to restore their energy. And so I think there are some ways you could use some different creative bibliotherapy too as tools to kind of normalize that sometimes, we're just going to take a little break, and not necessarily use some of these scare tactics as to expand upon why.
Right. That's probably good for, I was going to ask actually about communicating with a 3-year-old, because, I have a 3-year-old, but she doesn't really understand what a virus is. She doesn't understand, she doesn't understand anything. So do you have any tips for talking to just telling her why she can't see her best friend, or why she can't go see, or why we're in our house every day?
Mm-hmm.
I mean,
I think once again, even with I have a 2.5-year-old who's very inquisitive, so I feel that. I think, sometimes just once again, figuring out what they know or where they've gotten it from, to kind of ask, yep, we haven't seen Gigi in a while. What do you think about that? I have literally gone from having my parents and in-laws over every single day to nothing. And so I think too, with a younger child, sometimes FaceTime and video messaging is sufficient. She doesn't really,
that's true,
because she doesn't have that lapse of, that was last week. Cognitively, her brain is not processing that she has not seen Gigi in 3 weeks. Cognitively, she's just processing whether she's had any interaction. So I think, if you can interact with people in a virtual way, that can be a really nice, not that it's the same, but I know for my own child, she's blowing kisses, and I just kind of personally told her, you know what, everybody's just staying home right now, and she hasn't asked like, well, why or why or why. And so I'm fortunate for that. But once again, I'm kind of meeting her where she is, and then kind of giving a response to that.
I think it's important to think about, is it your own personal needs? Some of us are way more social than our children. And some of our children are thrilled to be at home. They love it here. And I've got patients that are like the happiest they've ever been, because they love their house and they love their backyard, and the parents are like, we need people. You just really have to remember that sometimes your own internal dialogue doesn't always match your child's needs. And so kind of stepping back and thinking about, is that you or your child's needs, wants, or desires?
Yeah, that's true. We had one more question, and this one is actually about grandparents. Do you have any advice for grandparents? Because they are so used to seeing their kids and having physical contact with their grandkids all the time.
Yeah.
I guess FaceTime.
Yeah. And one of the things, just to reiterate, that Dr. Camelford was speaking about is, doing that FaceTime, doing, Zoom meetings, whatever, sort of device that you have, androidic device that you have going on. And to sort of capitalize on that bibliotherapy, there's a great book by Patrice Karst. It's called The Invisible String. And it brings kids along the journey of these two little twins, are scared at night, and they go to their mom, and she teaches them the trick of the invisible string, that if you tug on my invisible string, it'll connect back to my heart and I'll tug back. And it just gives them some type of symbol. Kids under the age of 10, 11, cognitively, they're not able to capitalize on abstract hypothetical thinking, sort of that gray later on down the road. They're very concrete in their thinking. And so giving them something factual that they can hold on to, a physical string, a piece of yarn, something from a towel, from an old shirt, that you can find, that they can have. And there's also memorabilia around your house too, bringing in a picture of, Gigi to the room, or bringing in a picture of, Papa Petty, in your room, so that they're able to hold on to those things, and have some type of ritual, where it's scheduled, would be delightful for kids to use during this time.
That's a good idea.
Yeah, we've had grandparents that have got on and done some of the scavenger hunts and playing I Spy in the room. So I think the kind of prepping grandparents too for how to be more interactive via FaceTime, as opposed to saying, hi, what'd you do today, to a 3-year-old that may have a really hard time answering that, but kind of helping the grandparents with how to play, if you will, via whatever platform you're using.
Okay.
That's wonderful advice for sure.
Yeah. Okay, and we have one more question, and then this will be our last question. Any tips on prioritizing your own self-care while adapting to the new normal?
Oh, I think we can all three speak to the oxygen mask, right? There's a wonderful researcher and well-renowned play therapist in our field, Dr. Gary Landreth, and he always uses the oxygen mask analogy. You have to put it on yourself before you can take care of kids. And so that is always our top recommendation to parents, that we need to find a way to take care of ourselves before we can do that for our children, and not take care of our kids first and then help ourselves out, because it unfortunately never gets done.
Right. That is very true.
Yeah, I think too, when we role model that we are taking care of ourselves, then that is something our kids can hopefully learn and then be able to do for themselves. So I think sometimes too, it can be appropriate to tell your kids, you know what, mommy needs a minute, or daddy needs a minute. Or if you are lucky to have a spouse or a partner who is helping in the caregiving, so say, you know what, please watch the kids for a minute. I need to, go take a breath, or I need to go just sit in the tub for a minute. So making sure you're having just the awareness of when you need time for yourself, and then how do you advocate to get that so that you're not feeling guilty.
And I would add in too, parents that are doing it all by themselves, who do not have extra supports in their home environment, to find a way, a time, even if it's 5 minutes, to engage in something that's positive, uplifting, and alleviating for them.
Right. All right. I think that's everything. I think that's all the questions we have. Crystal, if you want to wrap us up.
Yes. Okay. So we are going to be continuing to host these webinars over the next several weeks. Our website is going to have the schedule. So stay tuned to who's coming up next on our website. It's going to be with Dr. Summer Marshall, who is a nurse practitioner, and she's going to be giving a real account of the nurses' experiences on the front lines, and that will be Tuesday, April the 14th at 2 p.m. So for that, and we're grateful that you all took your time. Dr. Dugan, Dr. Camelford, Dr. Vaughn, thank you guys so much. What you guys do is incredible and invaluable to our community, and we're so grateful to have you. And thank you for taking the time to join us today. And everyone stay safe, and we'll see you next week.
Thank you.
Bye.
Thank you, everybody. And this meeting will be available online on our social media channels and on the website. Thank you.